Assalamu alaikum. My name is Dr. Amir Kanji and I am a medical doctor by profession. Today I am here to speak to you in very simple terms about what blood donation is. Blood donation is simply the act of voluntary blood giving from a healthy individual to an individual that requires it. Globally, 118.5 million units are required per year to serve the demand that is there in the world. Blood donation is required under many different circumstances. Just to name a few is during pregnancy or during delivery, when mothers suffer a lot of blood loss during the delivery process, children and other individuals who have a lot of blood conditions such as cancers, they have hemophilia, for example, sickle cell that is very prevalent in this country as well. Blood donation is also required for those patients who suffer trauma, for those people who are involved in accidents. And as you know, worldwide, the #1 cause of death among young adults is accidents, and that is where we require a lot of our blood as well. So the next question comes is, why should you donate blood? As an individual, what should prompt you to donate blood? So first of all, you must remember and you must note that only 38% of the world's population is actually eligible to donate blood. And why is that? So there are certain criteria that have been put in place by the World Health Organization to make sure that the person who is donating blood is first of all safe during this process, and then we look at the recipient of this blood products. Donating blood, your 1 unit of blood can actually help up to 3 lives, because when you donate blood, that blood has different components. It has platelets, it has whole blood, it has plasma, and it has other products as well, all of which have served a different purpose to every individual that requires it. It is also important for you to donate blood, as studies have also come to show us that donating blood on a regular basis has shown to improve your overall cardiovascular and heart health. In Tanzania alone, there is a demand of over 100,000 units of blood per year. And safe to say that we do not meet this demand simply because there is not a lot of blood donations happening. When you want to donate blood, you will be first screened by healthcare providers. So the process begins with a few questions, which will generally ask about your overall health, how it has been during the last few weeks, to the few months, and up to the last year. Once that is done, and you are cleared in that section, you will then undergo a mini health screening, where we will simply look at your blood pressure, your heart rate, sometimes your oxygen level, and sometimes your glucose level as well, depending on which center you are in. Once you are cleared of that, then you will be required to go to the blood donation room. In the blood donation room, what an experienced healthcare provider will do is basically you will be put to rest on a bed. You'll be told to relax. Okay, you will be given something to eat or drink, if at all you have not eaten or drank anything prior to the blood donation. Once that is done, an experienced healthcare provider will come to you and he will gently look for the veins in your arm. Yeah? So blood donation generally happens in the arm and not anywhere else. Okay? And it is done by a trained medical personnel. So that should allay any fears that one might have when you come and donate blood. So the area that is going to be pricked, okay, the needle that is going to be pricked into your vein is going to first be sterilized before it is put in. Then generally the process of donating blood takes anywhere between 15 to 30 minutes depending on the flow of blood. And usually during one sitting, at least in Tanzania, you will collect about 450 ml. 450 ml is about 8% of the total amount of blood that any individual has in their body at any given time. And it is safe to assume that the blood that you donate, you will automatically recover it within 3 to 4 months. And that is why we allow male individuals to donate after 3 months and female individuals to donate after 4 months. Once you have completed the blood donation, you will be asked to take a rest for a few minutes, and generally you will be told to avoid any strenuous activity during the whole 24 hours of the day to come. Otherwise, there is no risks involved, and if at all there are any instances that do happen, medical professionals are always available during the blood donation to make sure that the donor's health is not compromised. Remember, the first person that we do look after during these blood donations is the blood donor himself, and then we go to the needs of the patient. So with that in mind, CareSpace has been conducting a blood donation program called the Hosseini Blood Drive for the last 10 months now. It has been taking place every month on the last Sunday of every month at Ibrahim Haji Hospital. And up to date, we have collected over 1,100 units, and each month we will still continue to do so. So please consider this as an invitation and consider this as an important event that takes place every month, and that the demand that we require in this country is simply too much, and that there is no way to generally get the blood apart from your support, where you can come and voluntarily donate blood.